Are you ready to learn how to heal from your emotional trauma? We're diving into the world of EMDR therapy. I have a licensed therapist, Ciara Helm, who specializes in trauma and grief recovery using EMDR. Ciara has helped countless individuals find healing and build resilience, and today she's going to answer all our questions. So let's get into the episode. Okay, everyone. It is Mental Health Awareness Month, and I am so excited for us to continue to have the conversation about mental health, specifically in regards to emotional trauma and different methodologies. I've been really interested in just learning a little bit more about EMDR, and I'm going to go ahead and give it to Ciara, who is a therapist using this modality, has found success with her clients. So, Ciara, welcome.
Thank you. Hello. Aw, I'm so excited to be here.
I know, me too. I feel like it was like about a year ago since I was in your podcast. So it's kind of like a full circle moment now, you
It
being on mine.
is. It really is.
I would just love to know for the people, because I'm here, you know how everybody just like shoots out acronyms and they're like, what the heck does that mean? Could you start by just exploring a little bit on what EMDR is and how maybe it like is different from traditional talk therapy?
Absolutely. Therapy has its own language. So EMDR is actually eye movement desensitization and reprocessing, also known as EMDR. And it's an incredible type of therapy. Technically, it started in the 1800s, the concept of its foundation, but it really got its name and therapeutic approach in about like 1989 with Francine Shapiro. And it's a type of therapy that stimulates the brain, that helps with things like trauma, which is what it was initially meant for. And it's a little different than other types of therapy because it's way less talk, which a lot of people think I'm going to therapy to talk. It changed my own life, and it's an honor every time I get to use it with somebody and see them get that change that they so deserve.
Yeah. And this is definitely something that like therapists have to get trained, right? Like mostly in like traditional master's program, you're not seeing kind of this modality being taught. It's almost like you have to kind of take this other specialization.
Correct. With EMDR, you have to be EMDR trained, which means that you've done at least a minimum of 50 hours in training alone, let alone not even including your field work. And then you can be EMDR certified, which takes even more time. And it's a process, but it's because it's such a unique type of therapy that really you need to know what you're doing. I've had a lot of clients who have come to me for trauma therapy or for grief therapy. And, I'll tell them, I use EMDR, and they'll say, oh, I've done that before. And it's totally not EMDR. There's just some therapist who kind of knows about it and tried to use it. And it's a very different experience that way.
Oh man, yeah, I can see how sometimes it gets like, because you don't know, right? We just see EMDR trained. We don't know how much the training. We know the minimum, right? But like even more after that. Wow, that's crazy. So you feel like a big difference on EMDR and traditional forms of therapy is the component of like talking. Are there any other like differences between it? Like maybe comparing it to CBT?
Yeah. So with EMDR, you're going to have someone who walks you through the process of getting what's called like the target image. So you're walking them through really because the speed of thought is much faster than the speed of speech. And we know that to be true. Like how many times have you been, somebody asked, like, especially for women, they'll say, what are you thinking about? And then it's like A, B, C, D, E, F, G. Like I thought about this, and then I realized I had to do, and it all happens within a minute, and so EMDR really focuses and enhances that quality of our brain, that it can really process things a lot faster without us having to articulate it. And I have found that to be helpful, especially with people who have a hard time sharing or thinking about those things, or even understanding how they feel because they've suppressed it for so long, or being told that what they think doesn't matter. So it's this really great space for people to be able to really have the support that they need and go at their own pace. Like I don't press if they don't want to tell me what it is that they're thinking. I technically don't have to know. We call it a private image, and I still walk them through the process. So it's really unique in that sense.
That's amazing. It almost kind of feels like you're going at their own pace, and you don't have to know everything in order to get them to like from point A to point B, which is super, super cool. Do you think that there's anything else during the process of doing EMDR work on a neurological level? What are we seeing in the brain or in the whole process?
The science behind it? Well,
Mm-hmm.
that's my favorite part. And this is the part where I have to like, I usually will show a video because it's hard to explain it and it not sound very, when I first did EMDR, when
Mm-hmm.
I tried EMDR, I remember sitting and thinking like, this just feels very like, what is it that you're asking of me to do? And I couldn't understand it because I had spent so much time suppressing those anxious thoughts and suppressing those horrible memories, that to have somebody sitting there and trying to make me think about it was really challenging. So the way that the science works is we are going to sit down in an EMDR session and we're going to stimulate your brain. Now that in itself sounds scary. So the way that that works is very simple. If you're sitting here right now and you were to what we call a butterfly hug, which what's really cool is Prince Harry actually does EMDR, and this is what he actually showed himself doing in the EMDR session with his therapist. But doing something as simplistic as this, which is called the butterfly hug, crossing your arms and tapping your shoulders, this is actually bilaterally stimulating your brain. What that means is your brain has two hemispheres. So as we're sitting here doing this, I am stimulating the left hemisphere, which is my logical side, and the right hemisphere, which is more of like the creative side of my brain. Now, when we are experiencing a trauma or anxiety or something like that, our brain is actually more concerned with keeping us safe, right? We have our nervous system that gets set off, the amygdala, everything's going, firing off to keep us safe. And when that happens, when your heart rate gets over, I believe it's 80 beats per minute for athletes and 100 beats per minute for non-athletes, we are no longer engaging what's called the prefrontal cortex, which is like the front of your brain, which is like right now what we're probably using. And we're sitting here having this conversation and we're able to process and use logic. Well, once we get to that point where we're feeling overwhelmed, we're now in that fight or flight state. And that means that our peripheral vision diminishes, our body's getting ready to keep us safer. Even our hearing is a little less because everything's running towards the heart and trying to keep us ready, right? We got that adrenaline going. So, with that said, with EMDR, when we have that trauma happening, we're less likely to really fully remember what it is that's happening, right? So, because of that, you'll hear people say things like, I blacked out, or I can barely remember, or that the one thing just keeps playing on in my mind, right? So when that's an indication that we didn't fully process what happened. So I'm focusing a lot on trauma, but I love that EMDR has this fluidity to help in other areas. But when we're looking at it for the trauma scope, when we use EMDR, we're not going back into that moment and we're stimulating the brain in a way that helps increase your cognitive functioning with that bilateral stimulation. And so now we're able to really process it correctly because we're giving room for our body and our brain to work together as opposed to working against one another, which is very often what happens. And then we find ourselves constantly having it kind of come up for us out of nowhere, or we have these intrusive thoughts or dreams or moments of panic attacks. And that's our brain trying to process it, but it's struggling to do so. So we give room in EMDR for you to be able to do it in a safe setting, knowing that that bilateral stimulation means you're in what's called dual awareness. You're sitting here with me, but we're going back to that memory. And so I often say to my clients, remember that a memory has a beginning, a middle, and an end. And even though this is a really hard memory for you to go through, you're sitting here safe with me and we'll walk through that process together. And there creates this room of safety and control, which very often when you go through something, you don't feel like you had control over that.
That is so cool because I think even like as primarily being taught CBT and when we're seeing clients with like resistance to kind of sharing certain things, this almost kind of helps them have less resistance to bringing up because if for them they always want to resist it. Like, I don't want to recall it because it brings such uncomfortable, maybe intense feelings. I love that this can kind of give them a way to be able to pre-process the memory in a way that feels a lot safer than it happening just like on your day to day, on your drive to work and you're like, oh dang, like I need to take a pause. It's sometimes, I mean, we can't help it, right? But yeah, that is so cool. Like, I'm like, it enhances like the connectivity in our brain.
It does. It's really cool. And a lot of times that's why people who go on walks and stuff, or you go for a run or whatever it is, it kind of clears your head. That's also
Mm.
technically bilateral stimulation because your left leg, right leg, left, right, left, right. And so we're bilaterally stimulating the brain, and that's why that happens. So it's fascinating the way that our brains work, and when we lean into that and give it room to do what it's designed to do, and it's capable of,
Yeah.
it's fascinating. I love it.
This just kind of like opened up my eyes for something because I remember seeing someone doing like a study with me or plan with me vlog, and they were
Mhm.
using bilateral beats. And it
Yeah.
was like interesting, just like how focused you can get and how just like almost I could feel like my stress levels kind of going down. And so I'm assuming that when we do this, it may help like normalize some of our stress hormones, specifically like cortisol, right? Like, which is usually probably elevated, would you say, for people who may have like PTSD more so than others?
A lot of time with PTSD, I say this all the time. I may not have a client who meets all of the like diagnostic criteria, but they definitely have a trauma history and they have, remnants of that trauma in their life. And because of that, like they'll really struggle with their body going from 0 to 100, right? That book, The Body Keeps Score, it's so true. And the way that our body remembers, hey, this is it. I'm detecting an emotional threat or a physical threat. I'm going to do what got us out of this last time. And so then it starts to continue to use that because it's created this neural pathway and it's going to keep using that neural pathway. And the way that I explain a neural pathway is your brain is like a highway, right? And it's going to take the same way every time, just like you do probably on your way home from work. But what we can do is introduce neuroplasticity and help your brain to understand and create a new way to move and go through that. And that's what's so cool about the brain is that it can kind of heal itself and find this new neural pathway. Now we no longer are going to respond in that same way. We found a new route to get home and we're going to take that route every time. But that takes time and practice as well.
I was listening to a podcast the other day and it was a psychologist who was saying like the biggest indicator of good mental health is neuroplasticity. The more neuroplasticity, like the more flexible you are, basically, in layman's terms, the more flexible you are, the easier things get because you're building this resiliency to a lot of the challenge. Because of course we can't stop external circumstances from happening, like they're gonna happen. So building that resilience, where that is through, hey, there's all these things that have happened to me and I haven't found a way to kind of process them in a way that's safe. EMDR can kind of like break that wall and help people learn a little bit more of like the resilience part of being more flexible with things.
Yeah, there's this really cool part of EMDR because as we're doing our sessions, before I ever do it, I tell all the time, like when people who have had a really bad reaction to EMDR, like they've tried it in the past and they're like, oh, it was horrible. I always ask the question, like, did you do framework? Did you do your foundational stuff? And more often than not, these therapists who aren't trained will throw these people into the deep end and they're like, think about the worst thing that's ever happened to you without giving them any kind of grounding skills, without giving them any kind of de-escalation stuff. Like, I'm going to put tools in your tool bag before we do that so that it's a gradual way into the deep end together. And so I love it because as we're doing that, the client is learning these really great adaptive shifts and these really great tools that they can use not only in session but outside of session. And then we kind of find after EMDR, after we've worked through some stuff, there's this blank canvas, which can be daunting as well. So now we're learning new skills, right? Okay, now we know not to do that. So how do we have healthy relationships? How do we have healthy boundaries and all of that stuff? So it's really cool.
That is so cool. And I'm glad you talked about like building the framework because even I do exposure therapy with my clients who have like OCD or Puro. And a big part of that is working on the mindfulness piece because I don't want to throw them into some kind of exposure and they're not ready. Like from each level of exposure, like if they're not ready, they're
Mhm.
going to hate me. They're going to just like not come back. And I hear that a lot that sometimes people go into EMDR and they're like, this is too much.
Yeah.
I just can't handle it. So I want us to backtrack a little bit.
Yeah.
I want you to walk me through an EMDR session, like a
Yeah.
typical EMDR session for you, and
Mhm.
then how it may differ with other therapists. Because I remember like having a conversation with you, and there was like all these different devices that you could use, not
Yeah.
just like the typical, the bar
Yeah, the
with the
light bar.
lights. So yeah, I would love for you to walk us through that, just like your typical
Okay.
session.
A typical session. So really with me, I'm gonna see a client one, two, at least 2 or 3 times before we ever start EMDR. And the reason being is I'm going to do their intake. We're going to get to know each other. I'm going to give you homework, which is called the timeline, which is what we're trained on in EMDR, formal EMDR, which formal EMDR means you're EMDR IA, International Association, EMDR International Association, which is Francine Shapiro's, and it's her protocol and her trainings, which is who you should be going through, considering she's the person who developed it.
Yeah.
So when you go through that, we're taught to really do some framework in the beginning. So we're going to do foundational pieces, right? We need to build the rapport. I need you to trust me and to know that I'm here for you, because we're talking about things that are really hard. The other side of that is I'm going to do the timeline. Timeline means I usually will have you sit down on your own pace and fill out a form that gives you a target image, any sort of, and what I say all the time is, I think when people think of trauma, they really think it's like the big T things, right? So it's like really stressful, horrible things that have happened. And they're like, well, I never went to war, or I was never abused, or whatever that is. But really trauma is just your brain struggling to process something that happened, and it had a lasting effect, and it affects your ability to function daily. It affects your ability to emotionally regulate, all of those things. So what I love about EMDR when we're sitting in that timeline time is you're sitting down and thinking of any distressing events. So I'm going to have you write anything down, and people will very often be like, I never thought about it, but I'm going to write this down, and I haven't thought about that in years.
And you're doing this virtually, right?
Yes.
Because I want to make sure, like, for the non-believers.
So for the non-believers, EMDR is really cool because you can do it anywhere. So yes, that's usually the homework that they do. And then once we've done that, we'll review the timeline, and then I will do what's called our framework. I'm going to do foundational work, which is creating what's called a safe space, or a performance, like a safe or calming place, depending on the person. And they may not feel like they need a safe place, but maybe a calm place where they can think in their mind. And then we're going to do what's called the container. And the way that works is we're kind of trying to help your brain to understand we can compartmentalize in a way that's healthy instead of suppressing. And so the container is a way for us to be able to place these distressing memories into a place in our minds, which this is the part where I'm like, I remember sitting in my own EMDR session, and my therapist asked me to do this. And I remember I think I sat in silence for like 5 minutes trying to understand what the hell she was asking me to do. And I was like, I don't know what you're saying, lady. But it took my brain time to understand how to really visualize myself compartmentalizing this thing that I have tried so hard not to remember. And then once we do that, it helps the client in between sessions to be able to feel like if something comes up, it doesn't mean we're never going to talk about it, but it doesn't mean we have to deal with it right now. We can still go throughout our day. I'm going to talk about this with Ciara in our next session, but it just doesn't have to be in the driver's seat of my life. I'm just going to put it in the trunk. And so that's how we kind of help them to still function while we're doing this deep work. And then we'll move into our first EMDR session. We'll pick something from the timeline that's a little less distressing, and then we'll kind of work our way to the biggest stuff. And as we're doing that, we're going to do what's called the 8-step protocol. So we're going to visualize the target image. Now this can take time, but I'll just briefly kind of explain it. Target image means if we were to take a picture of what that memory is, or what that thought is, that anxious thought, whatever that is, depressing thought, we're going to take an image of that, pause it at the most distressing part. What's your negative narrative, what that says about you, your negative I statement, pair it with a positive I statement, what you'd like to believe about that. Then we're going to say, how true does it feel to say that positive statement? And we're going to scale it 1 to 7. Then we're going to say, how distressing does it feel? Not distressed at all, to 10 is most distressed you can be. Then we're going to move into, where do you feel that in the body? What are some emotions that are coming up? And then we're going to let you go. And you're going to think on that thought and let your mind just go wherever it wants to go. And I usually explain that it's kind of like being on a train. Things pass really quickly, and you're just going to be that passenger and let your brain do what it's meant to do. And then a good therapist is going to check in periodically, see where you're at, and then help guide you if you're kind of moving in a direction that's, you're thinking about chores instead of what you should be, just keeping you on track. And then we move on from there, and it continues to go. And as we're seeing adaptive shifts come in, and what's really cool is if you give your brain the time to think on it, it can process things correctly. And instead of it being, I'm not good enough, or I don't matter because this person did this to me, or this happened to me, or whatever that is, we find these really great adaptive shifts And we're able to process it to a point where we kind of desensitize the anxiety part of that or the painful part of that. And we move into this time of being able to say, yeah, this happened. But this wound is going to heal correctly this time because we've kind of pushed out all of the impurities in it and we put the bandage on it and all of that. So long story short, it is an 8-step protocol that you work through each time, and you'll do it every single session. And then afterwards, we'll pick back up if it doesn't finish in that session, or we'll move on to something else on the timeline.
And can clients expect like this to be 50 to 60 minute, like typical therapy sessions? Because I've even saw some people have done in like intensives, right? Would you
Yes.
recommend that to people? Not like to every, like, I don't know. Because I think of intensive and I'm like, oof, that's a
I
lot.
struggle with the intensives. I really do.
Yeah.
Here's my thought on it. I really like my clients to, especially my trauma survivors. You have spent so much of your life living a certain way. I want to know what you're experiencing going back to normal life. And I want to come back and work on things. And I want to come back and help you to find different tools, and relationships have now changed, right? Because you're not the same anymore. So to me, an intensive, I can understand how it would work, but I want to help somebody get through the process of the aftermath as well as like the work itself.
Yeah, it sounds like it could be in a better perfect world. It would be, they would go through kind of like your pace and like the method, right? Like going through everything for like, like typical. And intensives would be like, hey, a couple years from now, all of a sudden, like maybe you want to work on a specific phobia or something, and maybe we can do an intensive. But we've kind of processed like the things that kept resurfacing.
Mm-hmm. It's like a big glass. We're gonna put the big things in first, and then try to pour the sand in as we're filling it up, and it'll fill all those grooves. But we got to get those big pieces in first.
Yeah. I also heard like one session of EMDR is equivalent to 10 sessions of talk therapy, which just like
It can
blows
be.
my mind.
It
Yeah,
can be.
like it can be
Yeah, it's dependent on the person. But I
for
will
sure.
say, I have found my turnaround is so much faster in
Yeah.
EMDR. I'm constantly like, well, because they'll be like, I mean, I don't know. I feel great. And I first learned about EMDR when I was working in human trafficking relief and I was the program director. I was sitting in on these sessions. Before I became the director, I was interning there as their clinical intern. And so I would sit in on these sessions and watch these incredible survivors go through things that nobody should ever have to have faced, right? Trauma beyond what you can imagine. And they would work so hard just to make it through the day and then sit in these sessions. And suddenly they had the courage in the room to be able to feel what they felt and process those things. And then when I became the director, I was also offering and learning about EMDR. So I was like, listen, if I'm going to do this, I need to do it myself because I'm also a trauma survivor. So I sat in EMDR, and things I had carried for most of my life, so decades. I won't say how many because that'll date me, but decades. I honestly was so shocked at how incredible I felt after, and I didn't deal with those things anymore. Now
Yeah.
that felt like, is this real? Because it was like I was in therapy before, but EMDR really
Yeah.
really changed my life.
Yeah. I mean, and do you think just like, regular talk therapy, the relationship with your therapist is also a big indicator of a good outcome with this particular form of therapy?
I think so because you really have to have the rapport with your client. I say all the time, like I interrupt a lot because I have to, because as we're doing bilateral stimulation and the way that you can bilaterally stimulate, there's 3 common ways in EMDR. So it's sound, sound, tactile, and visual. So very often it's like a light bar, which is great because before that it was your therapist and they're using their finger. That was how it was first developed.
That's a workout right there.
Girl, I'm so glad we're not there anymore. Not the finger, the whole way. Get out. I would not be an EMDR therapist. I don't have the muscle capacity. Um, but now it's like a light bar and it's your line of sight. And then I use auditory because I'm completely online, my practice.
Mhm.
So as long as you have headphones, I have a program that I use and it will, the same way that sound goes from left to right, it's just like that. And we pick out a sound and we do all this other stuff. And then the other one is a tactile, which are these little buzzers in your hand that just like vibrate, little vibrate. Feels weird to say little vibrate.
A little vibrating. Yeah, everybody get your mind back to EMDR.
You call them tappers. Okay.
Yeah.
Little tappers, and you hold them in your hand and they're going to alternate in how they vibrate. But yeah, so the way that they work that way, and then I want to keep you in that state of bilateral stimulation. So every time that I'm talking to you, I'm pulling you out of that. So it's a very brief check-in when I'm checking in, and I may interrupt you, but that's because I want you to go back in, because you talking to me, it's disturbing what your brain is trying to do. So yes, you need to have a good relationship with your therapist, and your therapist should explain that too. I very often will say, hey, listen, I'm going to want to talk about it. And if you want to talk about it, we absolutely will in the next session, or we'll take a pause. But when we're in it, we got to stay in it. But I'm here with you the whole way. So that helps sometimes.
I really like that you kind of explained the three different types of ways that, therapists can do EMDR, because I'm also thinking of like people who have visual impairments, right? Or a hearing impairment, right? Or motor skills issues, right? Like there's different ways that they can still participate in this type of modality in a way that's accessible like to them. So I think that was going to be one of my questions, like how accessible is this for people? Right. But it sounds like it can be, you just have to kind of find the right person. Like because I'm also thinking like if certain people when it comes to auditory might have a difficult time.
Yes.
I don't know if you
I've had
noticed.
clients who have a hearing issue or things like that, and we'll just work to check and see if it's working. So I say this all the time. If auditory isn't for you, that doesn't mean that you can't do it. It just means you might have to find somebody in person so that you can do like a light bar, or we'll try things like I've done with another client. They had an Apple Watch, and I forget the other thing that they had, but it was still stimulating on their side. Or we've done where they sit there and do the butterfly hug the whole time, which to me, I'm like, listen, if you do that, you are dedicated to your work. So yeah, I think it's important to find the right type of EMDR for you.
Yeah. Which brings me to like the next question, which was like kind of like challenges, right? So we talked about the potential challenge of like it, you kind of trying to having to find what works for you in terms of the style. But any other challenges or misconceptions that like your patients, not patients, but clients have faced with EMDR therapy?
A few things. One, there are certain people who would not qualify for certain types of EMDR. For example, like a light bar is probably not good for somebody who has epilepsy, right? Somebody who has had brain damage or like significant brain injury, they may not have the capacity to be bilaterally stimulated at the level that we're trying to get them to. So maybe they may not be the right fit.
So people who have TBIs or any neurological issues, right? Yeah.
So because we're trying to get your brain to do something, and if it just physically can't do it, that's okay. It just may mean that that's not the best option for you. But there are other really great types of trauma therapy out there. Like I've heard a lot about brain spotting. I know of somebody who does biofeedback therapy. So as far as misconceptions, I would say the fact that EMDR started for PTSD and trauma, it has stayed well known for that. Like it's known worldwide. The World Health Association, the veterans, what else? The Department of Veterans, the APA. There's a million renowned organizations that recognize EMDR to be clinically effective, and it's evidence-based and all of that. But now we know that since 1989, and we've been doing it for so long, now we know that EMDR can help with so much more, like depression and anxiety and phobias and addiction and multiple personality disorder, also known as dissociative identity disorder now. So there's a lot of things that it can help with. I'm glad that it's still known for trauma because that's what I do, but I use it a lot for a lot of other stuff because, people come in and they have trauma, but there's a lot more to it than that. So helping people to kind of walk through that. I use it for grief therapy all the time. It's really great and super versatile.
Yeah. What about the misconception EMDR is quick fix?
I think that EMDR, there's two. I would say that EMDR is a quick fix. I think is not true because EMDR is going at the pace of the person. And if you come in with an expectation that you're going to be fast and it's going slower than what you anticipated, you're robbing yourself because EMDR really is just meeting you where you're at. And if you need more time, give yourself space and grace to do that. I think that's super important. So that I think is a huge disservice that I hate that misconception because when people come in and they're not moving that way, they feel shame and disappointment in themselves. And the other one I would say is that EMDR is like hypnosis. It is not. I hear
I've
that
never heard
all the
that one,
time.
but okay, yeah,
All the
yeah.
time. When I'm sitting in a session, people are like, "So is it like hypnosis?" I'm like, "No, it's not." So
Yeah,
EMDR is not hypnosis. It's completely like self-determination. You are going at your own pace. I'm not doing anything. I'm not stimulating your brain in a way that it doesn't
yeah.
want to. So yeah, I think those are the two that I hear the most.
Yeah, yeah. Well, also the biggest challenge too that I've also heard, not a misconception, but a challenge is like the emotional intensity. And you kind of alluded to that when you were talking about it. Like, do you think everyone kind of experiences that emotional intensity, or just like depends on the person?
It depends on the person. I mean, I've never had somebody sit in an EMDR session and not have this emotional, like, it evokes things that we've tried to suppress, right? So, yeah, it's going to be that. But you already have all the tools. If we need to pause, we pause. If we need to use some deep breathing exercises to help bring your heart rate down to re-engage that prefrontal cortex, we're going to do that. Like we have everything that we need. And so I tell clients all the time, like, I want you to have an emotional reaction. I'm not going to bring that out of you, but if it happens, I'm not going to stop to comfort you either. And that is where I always feel the therapist in me wants to stop and hug you through the screen and just, but in all honesty, those feelings need to come out because our feelings are there to tell us something. And so when we allow ourselves the space to feel sadness, to feel anger, to feel fear, we can learn the need behind it that wasn't met. And so it's this moment where it's very raw, but the work that we're doing this time is so different than the pain from what started it. We're doing like a good workout kind of pain where afterwards you're like, ay, me duele. Like, I just can't. Like, yesterday, I was doing a workout and my muscles were like shaking and I almost wanted to stop, but I know that if I continue, I'm going to get stronger. And that's the same thing for EMDR. We're giving your brain the space to try and move through this. And yeah, it's really hard. And yeah, sometimes we feel tired after, and sometimes we're like, that was a lot. But this pain is moving us towards healing versus the other. That's just going to continue to perpetuate.
Yeah, I love how you kind of said like it's almost like building muscle, right? Like the muscle has to have some tension in it for it to be able to grow, like for it to be able to kind of go to the next level. And if we resist that and we're just kind of staying in the same space, nothing happens, right? We may even lose muscle over time because we're not really working through that. That is so cool. Any success stories that you can share? I know because of HIPAA, like we can't really be very specific, but like any significant transformations, maybe there's like a specific diagnosis and you saw, oh, improvement in like this area in their life or something.
I mean, I would say as an intern, I won't speak like of my clients that I have formally without their consent. When I was interning, I was able to watch these incredible survivors with things like multiple personality disorders and borderline personality disorders and a lot that they had been through. And I watched as they were able to really move into this space. And I've never seen, I at that time I had never seen dissociative identity disorder in person. I had learned a lot about it, hours and hours of classes and studying, and then I saw it present itself in person, and it was this beautiful moment where they were able to find space to love on like themselves and these parts of themselves that were fragmented, and they have felt safe to kind of come together as one unit and talk about what happened. And that was probably one of the most unique experiences in my clinical career. And then for myself, like I said, I would say my own personal experience with EMDR is why I dedicated my career to EMDR because it changed my life. It really did. And I have never struggled with the things that I struggled with before it.
Oh, that's amazing. Oh, well, I mean, you talked us through a lot of the things of EMDR, and thank you so much for like sharing those experiences. What about self-care post like session practices? Like, especially if like the person like in their head is like, oh, this could be so intense. Like, I don't think I can handle it. You mentioned about like the framework in the beginning and then post also. So I'm thinking like, what are the self-care follow-up practices that you recommend?
Yes. There's quite a few things. So before we finish, I always leave time for us to really close out and put things in that container that we talked about. And I say, leave it with me and we'll pick back up in the next session, which sounds very strange. But when we sit down and we do that exercise, it really helps people to feel like, okay, I can still go through the week and we'll be okay, because it's not like I'm telling my brain, yeah, this happened. It's just not happening right now. And so being able to give them that understanding to compartmentalize sometimes can be really empowering for people. Then we're going to do some grounding stuff to help get you to a place where at least your heart rate's not as elevated. And then I always ask the question, what's one kind thing that you can do for yourself? And then I find now one thing that EMDR can do is it can start, because we're kind of digging up these deep rooted things that people will experience, things like dreams and things like that. So I'll recommend, hey, sleep with a journal next to your bed, write it out. When it comes up, brain dump that thing. And very often that can be really effective. I've used it even when I was working with survivors. We would journal a lot because they would dream a lot, because sometimes we don't give room for our thoughts during the day. And so they manifest in our dreams. So they find themselves having these nightmares. So we work through that, and I'll do things like, these sound so simplistic, but they're clinically proven to engage the brain correctly and help that amygdala. Even like lavender has been proven to engage the amygdala and help release serotonin. And so we'll do things like, I really want you to start connecting scent with this, if that can help, like with that calm feeling. So we'll help. Have you ever smelled like a perfume from like high school? And then like afterwards, you're like, oh my gosh, all these memories come flooding.
Yeah.
The same principle. So we use lavender or some sort of positive scent that eventually, as we're doing like this really nice calming moment of exercise, that when you smell that, now you're starting to associate that really quickly. And those feelings of calm and peace can come a little bit faster, because your brain now, it's like Pavlov's law, which means that we are now training your brain to say, I smell this, I feel this.
I love that. I love that. And the really cool thing about our brain is like metacognition, right? We can think about our thoughts, right?
Yeah.
Like it's like we could take a step back and actually think about what we're thinking,
Yeah.
right?
Yeah.
And even though, like, yes, there's simple things like being kind to yourself, like,
Mm.
utilizing, I just feel like our bodies just take so much information, like
Yeah.
through all our senses. Like, why wouldn't that be a place where we use it to help us, right, through
Mm-hmm.
healing, right?
Yeah.
Like the body takes information. Guess what? You control to a certain extent what information like you give it.
Yes.
So control what you can control. So I
Mhm.
absolutely love that. Do you have any advice for the listeners who are currently struggling with emotional trauma and are hesitant or unsure about maybe seeking therapy in general or EMDR as well?
Yeah. I love this question, because I think people really often minimize what they've been through. And to the person who is listening, who is struggling, and you're thinking, well, no, I'm just being dramatic, but it keeps coming up for you. Your feelings matter. What it is that you're experiencing, your feelings are real. Now, our feelings may not be facts, and that's the best part. That means that we can really understand the truth behind things, and we can find change and shift in these adaptive moments. But until we give room for those feelings to really understand them and give them room to be heard and to be felt and processed, they're not going to go anywhere. And they're going to start showing up in other ways in our bodies and in our way that we communicate and relate. So give yourself space to try, space to lean in. Therapy can feel scary sometimes, because the thought of having to talk about stuff that you have worked so hard to avoid feels like the opposite of natural thing to do. But when you do it in a safe space with the person who really is there to walk you through it, it can be this incredible healing moment. And you are worthy of that, regardless of what you feel, what you've been told. Everybody deserves a chance to heal and for change. And it is possible. It really is. I see it every day.
Oh. Well, thank you so much for sharing. How can people find you? I know you have some projects in the work, so feel free to share where people can find you.
I'm a little bit on socials. I would say
When it
I
likes you, when
someone
it's
when I
like,
like yes, 2 days ago I was getting a message from Instagram that was saying, "Hey, you've had some weird behavior again." They blacklist me all the time, so I'll tell you my socials, but just know Instagram hates me. So it's called Church Mental Health. And that sounds very strange because it's very different than what I'm doing, but it's my second business that I help create safe spaces and mental health informed organizations in religious organizations. So, church mental health is my socials, but I talk about things like trauma, grief, EMDR all the time on there and life in general. So, you can find me there.
Yeah. Yeah. And where are you located if someone wanted to work with you specifically?
Well, I am licensed in Florida. So, if you want to work with me and you live in Florida, you absolutely can. Doesn't matter where in Florida because I can work with you. You can find me at hopefulheartcounseling.com. And you can fill out a request there to schedule an intro call, a free 10-minute intro call, and I would love to have you.
Awesome. Well, thank you so much, Ciara.
Thank you. This was so much fun. Thank you for asking. I feel so honored. This was fun.